Alrighty. So, hi everyone. Thank you so much for joining us today, and welcome to the 8th live webinar presentation of the 2022 Hidalgo County Employee Wellness Fair. I'll be starting off this webinar with a sound check. So if you can hear me clearly, please click the raised hand icon. Again, if you can hear me clearly, please click the raised hand icon. Alrighty, perfect. Thank you so much. Before we get started, I would like to let everyone know that the attendees do not have a microphone feature on this webinar. If you would have any questions, please utilize the chat box feature or the Q&A feature, and we will answer questions at the end of the webinar. Our speakers for this session are Dr. Rene Ramon, Mr. Rick Saenz, and Mr. Juan Gaona. Mr. Ricardo Saenz Jr. has been a certified recovery specialist in Edinburgh for 4 years. Rick is from the small town of Rio Grande City, where he graduated and continued his education at Texas A&M University in College Station, Gigam, to study motor behavior and human body mechanics. Coming from a family of educators, Rick is passionate about teaching others strategies and exercises to help avoid pain and rehab current injuries. Dr. Rene Ramon is an Airrosti certified provider in Edinburgh, Texas. He graduated from Texas A&M University College Station, Gigam again, in 2001 with a biomedical science degree, and from Texas Chiropractic College in 2004 with a Doctor of Chiropractic degree. He has been with Airrosti for 8 years. He is passionate about providing the best soft tissue treatment to his patients to help positively impact their lives. Juan Gaona is Director of Business Development for Airrosti, a healthcare provider group that reduces costs for patients and health plans. Juan brings 9 years of experience in healthcare sales, management, and practice operations, and he currently leads Airrosti's team focusing on employer, broker, and carrier partnerships in South Texas. Born and raised in South Texas, he is passionate about developing strategies to lower treatment costs and, most importantly, educate on a solution to MSK pain for South Texas. Thank you so much, gentlemen, for joining us today for this webinar presentation. Whenever you're ready, I'm actually going to go ahead and stop sharing so that way you can go ahead and share. Thank you.
Thank you, Diana, for that great introduction. And thank you for everybody for joining us today. So like Diana said, my name is Juan Gaona, and I do work for Airrosti Rehab Centers. Today, we're going to be going over a good topic to talk about, which is health on the move. So I do have Dr. Ramon and Rick on the call with us. Dr. Ramon will be going over a couple of the conditions we're going to be talking about. And then we'll have Rick to kind of walk us through ways to help prevent a lot of these things. So we definitely encourage you to follow along with him. But real quickly, what is Airrosti? So Airrosti is a healthcare group of providers that specialize in resolving soft tissue injuries. We can pretty much resolve these in an average of 3 to 4 visits, so it's quick. Our doctors don't use injections nor medications. The only thing that they use in the office are their thumbs. So they use their thumbs to apply controlled pressure on the specific tissue that's called fascia. Now, fascia covers the entire body. It's responsible for a lot of the movements that we do, kind of keeps the muscles and everything kind of put together. Whenever this tissue gets altered, tangled, or damaged anyway, it doesn't have a way to self-heal itself. So that's where our doctors come in, using their thumbs, applying that control pressure, gliding it, making sure that it moves the way it's supposed to, getting that tissue to feel healthy again. That's only one part of our treatment. The second part of our treatment is we're going to give you active rehab. And these exercises and stretches are designed to help build up this tissue to make it nice and strong. We always say that we love our patients, but we don't want to adopt you all. So you come in 3 to 4 visits and then you're done. So we're going to show you on how to keep all these things, feeling pain-free from here on out. So one of the things that I said, like MSK, so what are the things that we treat in the office? So pretty much we treat anything from headaches and migraines all the way down to bottom of the foot plane, like plantar fasciitis. This little list right here kind of gives you a general idea of what we treat. These are some of the most common things that we see in the office. But if you don't see what you have going on this list, doesn't mean we don't treat it. It just means we didn't have room for it on the list. But one thing that we do in the office for the very first visit is we go through a thorough examination to find out exactly what the root cause of your injury is. So it's not your job to come in and say, I'm dealing with a rotator cuff pain or strain. It's just your job to come in and tell us it hurts right here, and our doctors are the ones that are going to diagnose you. So that being said, you don't have to come in with x-rays or MRIs or any other information like that. We kind of want to try to avoid all those unnecessary procedures by coming to us first. I always tell my patients whenever they come to Airrosti, they're going to learn 3 things: what happened, how it happened, but most importantly, how they can prevent it from happening again. So that kind of leads us to our presentation today, health on the move. We're going to understand lower body muscle pain. Like I mentioned, we're going to talk about conditions and pains that can occur. definitely going to talk about tools for prevention, and then we'll talk a little bit more about Airrosti on the back end. So let's understand what lower body muscle pain looks like or what it is. So why does it occur? There's many different reasons why. So prolonged time in one position. Now, this is not only sitting for those of you that are currently, working in 6, 7-hour jobs at a desk, but this can also be for those of us that are standing all day long. Putting pressure onto one side versus the other one can cause a lot of imbalancement within our bodies. So poor posture. Unfortunately, on a webinar, I don't see everybody, but I usually like to say poor posture turned away. And then as I turn back, everybody already shoots up and kind of gets back into a right position. Everybody on these calls should already know what good posture should look like. So we're not really going to cover that, but this is more just of a reminder to make sure you kind of keep those things in place throughout the day. Like I mentioned, imbalancement, when we use one side of our body more than we use the other one, that can cause a lot of imbalancement within the body and cause a lot of aches and pains. Limited range of motion. So when we can't fully extend our arms, our knees, maybe our ankles, that causes a lot of a domino effect from the hips all the way down, causing a lot of the aches and pains that Dr. Ramon's going to talk about. And then fatigue. When we talk about fatigue, weekend warriors. So that's one of my favorite terms. So Monday through Friday, we wake up, we take the kids out, we're running back and forth, we're going home, making dinner. So working out is not really a priority at that time, but then Saturday comes around and what do we want to do? We want to go get that 3 or 4 mile run in, kind of make up for what we didn't do throughout the week. If we haven't warmed up our bodies for that throughout the day, throughout the week, then that might cause a lot of issues that can happen as well. So Dr. Ramon and Rick are going to walk us on ways that we can help, get our tissues ready for that run or for that exercise program that we're going to do on the weekend. The low body load down. So like I mentioned, fascial tissue. So what is it? It's a very thin layer of tissue, covers the entire body from head to toe. Dr. Ramon uses a great example of fajita. If you ever clean fajita for the cookouts, that very thin layer of stuff you take off because it's nasty, that's exactly what fascial tissue is. So it kind of supports everything, kind of keeps everything put together, and it's all connected. So if we're dealing with something in a certain area, it may not be that that's where the ache or pain is coming from. It might be coming from somewhere else that tissue is being pulled into from there. So I'll have Dr. Ramon explain a little bit more of that in a couple of slides, but just kind of give you an overview of why when you come in, we treat one area versus another one, and it kind of helps with the pain. And then usually I like to tell everybody, pain is the last symptom that you're gonna feel. So a lot of people come into the office saying, I got hurt when I felt the pain. Well, our bodies are very smart. They're going to talk to us throughout, anything that's going on. I always like to use a vehicle as an example. So that little red dot, the little check engine light that kind of everybody's afraid of. Maybe on one day we turn on our car and it kind of makes a little shaking noise, but we're still able to drive. We're still able to go, right? So we got to get to work. We got to drop off the kids. Maybe in a week later, now it's, shaking as we're driving, but, nothing really has told us that it's not working, right? It's still turning on and going. Maybe 3 or 4 weeks down the road, we turn on the car and that little red light comes on that says check engine. That's when you're like, man, something's wrong with my car and I need to get it checked. No, the car's been telling you, it's been telling you for a while now that something's going on. Same thing with our body. If you have, tightness, you have soreness, you have inflammation, things like those things our body are saying us, hey, something's happening. We need to get something checked out. And then when we have pain, that's when the body's like, I give up. I'm going to give you the pain because I want you to do something about it. So that's kind of where we come in. We want to try to get you before the pain sets on. So listen to what Dr. Ramon's about to talk about and all the different conditions. If you feel like this is something that you're dealing with, we'll talk about at the end of the presentation on how you can come in and see us. Some of the chief complaints that we're going to talk about. So low back pain, sciatic-like symptoms, so sciatica, hip pain, knee pain, and foot pain. So if you're dealing with any of these right now, kind of take notes of what Dr. Ramon is about to talk about, and you'll get some good information right now. So I'm going to go ahead and pass it over to Dr. Ramon.
Thank you, Juan. Okay, so starting out with some lower back pain. Probably the number one condition that we do treat, the most common thing, still lower back. Most of us sit too much, at work, right? You got a computer job, you got a desk job, sitting 8 hours a day. You've been doing that for a few years. That's going to tighten up some structures. First of all, it's going to tighten up your hip flexors. Those are one of the main components of lower back pain. I think it's usually day 1 or day 2 that we'll treat a low back patient, their hip flexors. We'll do our manual therapy and get that good release. We'll teach them how to do their own stretches to keep that hip flexor nice and loose. The more that we sit, the tighter the hip flexor is going to get. And because of compensation, you're going to tighten up the lower back. Going to respond that way. Okay. Those lower back muscles attach to the lumbar vertebrae, the low back bones. They attach to the tailbone, okay? Sometimes those tight muscles will start to pull on the bones, and you're going to start to get a little sharp stabbing pain. Sometimes it's dull, achy, sore pain. Sometimes it's burning. Oftentimes the pain will present like vertical pain, like up and down pain. Sometimes it's more horizontal, okay? Some of the symptoms, let's see, difficulty sleeping, some aching, stiffness, some shooting pain. Shooting pain happens. You know, so lower back pain can shoot down to the lower extremity, all the way down to the feet and to the toes, okay? When that happens, sometimes we do suspect that it's either sciatic nerve pain, which we'll talk about here in a little bit. Sometimes it's a disc herniation that we do suspect as well. Some of the key players, weakness in the posterior chain, that just means you're weak like in the low back and weak in the glutes. That's another common side effect from sitting for too long. We're not using the glute muscle, we're not using the lower back muscles all that much. We tend to slouch a little bit, so we start to get a little bit weak there. The core gets weak. The core is like a chamber. That's just like, it's an area around the torso that acts like a corset. It's supposed to be nice and tight and snug. And for a lot of us, our core is weak because we're just not getting enough work in there. So that's always part of the rehab. Let's go to the next one. Let's see, hip sciatic-like nerve pain. So from the picture, you can see the little red areas there. Yeah, it's kind of tied into that lower back, but then you see that red strip, a little strip of pain going down from the lower back down through the glute and through the hamstring. Typically, this is going to be one-sided, okay? We do see plenty of patients coming in with this, and typically we're looking to treat in that glute area there. So we sit on those glutes again. The glute gets a little bit tight and spasm. There's a muscle called piriformis. It's right in the middle of the glute. It's a deeper glute muscle. We want to get in there, do our manual therapy and release that, show you how to use the lacrosse ball and foam roller to do your own releases. And we can work on any other muscle that we need to that's in the lower leg specifically. We see that a lot. There's a muscle down on the lower leg called the peroneal muscle group. That's the side of the lower leg right there. That's typically one that we do release and work when a patient comes in with hip and sciatic-like nerve pain. Again, some of the culprits are going to be a tight hip flexor in the front, the weak glute, the weak core muscles right over there. Your body just responds by spasming the glute and contracting it and holding that contraction without your permission, basically. It's just kind of doing it on its own. Let's review some of the symptoms. So shooting pain, numbness and tingling. Numbness and tingling is one of them. So there's a little bit of a tingle that sometimes goes from the glute down to the feet and to the toes. It's uncomfortable with prolonged sitting. If you find yourself adjusting yourself, maybe trying to stretch a little bit, crossing the leg over the other, standing up, you know, those are oftentimes a symptom of this. The key players, again, the tight hip flexors, the weak glutes, Piriformis syndrome. Piriformis syndrome is specifically when that muscle, piriformis is a muscle, it's one of the glute muscles, the deeper ones. It just spasms, it gets tight, it contracts a little bit too hard. And it's our job to go in there and just go ahead and release that with our manual therapy and then teach you how to keep that nice and loose for yourself at home. True sciatica, we don't really see true sciatica all that often in our office, but we do. It's a referral to an orthopedic doctor, which we do have the connections to. Next one. All right. Knee pain. We haven't seen a lot of this lately. We like to call the knee the middle child of the family. And that's typically because really the knee oftentimes is more of a victim of the situation. It's usually about 8 out of 10 times knee pain is caused by hip dysfunction. There's a hip issue there. And the other 20% of the time, as far as causes are concerned, it comes from the foot or the ankle, okay? The hip really controls the entire leg. There's a lot of range of motion. You can go in almost any direction with the hip right there. The knee really doesn't do all that much. It just flexes and extends, okay? So the knee bears a lot of the brunt of the force when some things go wrong with the hip and with the ankle there. So we're looking to treat these patients locally at the knee because we want them to get the relief. But to fix more of the cause of the problem, we're gonna look to the hip and we're gonna look to the ankle there, okay? Let's see symptoms. We got some swelling, some instability or giving out. That's when you're just kind of walking or doing something and all of a sudden your knee just gives, okay? Lack of mobility, pain in and around the knee, sharp shooting, aching. Those are the most common symptoms to have there. Key players, sometimes we have a meniscus tear in there that we can sometimes detect with our orthopedic testing. If we suspect that, we're going to send that patient out for an MRI so that we can get a picture of those meniscus. Those meniscus, it's pretty common to have a tear in the meniscus there, especially for runners, people who jump a lot. exercise a lot, high impact exercise. That's usually what they're suffering from when the pain doesn't go away. Okay, so the pain doesn't go away. That's when we typically refer out for an MRI. And most of the time that we can't fix something, there's something a little bit more injured in there, a tear, Let's see, patellar tendonitis, that's a patellar tendon. We've all been to the doctor as kids where they take the reflex hammer and hit the patellar tendon and your kind of foot jumps out in front of you right there. That can get inflamed. Typically, we have a tight quad muscle there, a tight IT band, which is the side of the thigh. With too much tension right over there, you're going to get a little bit of inflammation. There's a lot of tugging that happens on that knee that becomes inflamed. Very treatable though. Let's see, IT band syndrome. So we mentioned that would be the side of your thigh, the outside part of your thigh, the side of the thigh. A lot of runners do get this. We oftentimes look to the glute, treat the hip flexor, and treat this IT band at the same time. That's another one of those knee to hip connections there, okay? Acute injuries like an ACL or MCL tear, those are things, most of the time you're gonna need to see a surgeon for those, and we would guide you along the way for some future consultations if you in fact have some kind of ACL tear or MCL tear. Those are ligaments in the knee, okay? All right, next one. All right, foot pain. If you look at the pictures, they've got the little red highlight around the heel, okay? But you see that little rubber band, looks like a rubber band attached to the balls of the feet and to the toes right over there that hooks into the heel, okay? And that's where the source of the problem is for the most part. That's your plantar fascia. Those are just the muscles of the bottom of the foot, basically. Some of the symptoms that patients can have is that heel pain most of the time. Sometimes it's a sharp stabbing pain in the middle of the foot, right down the center like a little stripe. Those first steps in the morning are very painful. For some of those patients, after they warm up a little bit, the pain goes away. For others, the more they're on their feet, the worse it gets for them, okay? So this is something that takes a little bit longer for us to fix. For the most part, we can't ask these patients to take a break. We can't get them off their feet because they got to go to work, right? You got your lives to live. But our treatment is we're typically doing our manual therapy at the bottom of the foot, on the heel, and the calf as well. So the back of the lower leg for the calves. Oftentimes we find really tight calves in these plantar fasciitis cases. And it's an area that needs to be worked, teach you the right rehab, stretch it. This is where the lacrosse ball comes in handy. It's something very, very effective for doing your own mobility to increase your range of motion here at the bottom of the foot to make your muscles stop contracting so hard and stop pulling so hard. Symptoms, pain in the ball of the foot, sharp pain in the heel, pain tightness in the arch. Worse in the mornings, we talked about that. Some of the key players, we also talked about the tight calves. If you have a tight calf, oftentimes it's going to shorten your Achilles tendon that's on the back of your ankle right there. Sometimes there is some tearing or stretching of soft tissue on the foot. Achilles tendonitis oftentimes does accompany this foot pain right over here. Those two areas are connected by the same fascial layer. Fascia is just that connective tissue that covers everything, like Juan mentioned earlier. So there's these patterns and connections that we can tap into to speed up the healing process for our patients.
Thank you, Dr. Ramon.
Thank you.
That was some great information. I know a lot of questions were coming in through all the different conditions that were going on, so I'll make sure we answer them at the end. One of the big questions that came in was how do we prevent a lot of the stuff that Dr. Ramon is talking about, right? So what we're going to do next is we're going to pass it over to Rick. We're going to go through a couple of slides here of the examples of way that we can help prevent a lot of stuff that's happened, that could happen, or maybe if you're already dealing with some of these conditions, ways to lower down that ache or pain. I'll have Rick kind of walk us through them, let us know when we shouldn't do these. But one of the big things to keep in mind, if you're about to do these exercises with us, that's great. If you feel any numbness, tingliness, sharp pain, make sure you come off of that exercise. We're not in person, so we can't fix it for you. But we'll work on ways to get you more information on that. But just make sure that you're not dealing with any sharp pain, because we don't want you to be dealing with pain while you're doing these with us. So I'll pass it over to Rick to walk us through them.
All right, here we go. So number one, guys, foam rollers. So many of you might not have seen these before, but if you have, they look like this hard, dense foam. And And what we use this for is basically to roll out our muscle, right? Those tight muscles, sometimes they feel lumpy, super tight knots, and all we do is roll over that tissue. Now, in the picture here, there's a few examples. The front of the thighs, the one on the left, all she does here is place her body on top in a plank position, and using her elbows, she pushes and pulls her body over the roller. Now this, if you've never done this before, it could be a little tight. It's going to be a little painful, a little uncomfortable, but the more we do this, the easier it gets. You can change the position of your legs. You can point those toes down first. You can open them out wide to hit the inner part of your thigh, and then you can point them in to get that outer part of the thigh. The other main foam rolling technique we do here is for our upper back. So you can see here on the picture on the left, she puts the foam roller right under the shoulder blades, elevates her hips off the ground, and just pushes and pulls her body and lets that roller roll up and down that upper back. This feels really good. Sometimes we get a little back popping. Feels really good. It should not be painful. It shouldn't be any nerves or tingling or anything like that happening. But the roller can be used in the front, the side of the leg, the back of the leg, the glutes. It could also be done on the low back. If you ever come visit us and foam rolling is prescribed, we'll do it with you. We'll make sure you're doing it correctly so you don't injure yourself. But there's a lot of things we can do with this foam roller. And they're easy to get. You can find these at Amazon in different sizes. 1 foot, this is a 2 foot version. The one she's using, the 3 foot, they're about $20 to $30. Can be found at Academy and Walmart as well. And we do have them here for our patients. Yeah, let's hit the next one here. All right, so hip flexor. Now, this is a big one, guys. A lot of people, and you can do this with me. I'll walk you through it. This is a good one for low back pain and a lot of hip pain right in this area. So we're just going to follow what she's doing here. If we want to do our left side, we're going to put our left leg back, right? Our hips is important. You want to tuck that butt under us. And once you find that tension on the front side of that left hip, we're just going to push a little bit, right? We want those feet, everything to be nice and straight. You want to find that tension on the front side of our hip. And once you feel that stretch, you want to hold that for about 30 seconds to 1 minute. And we'll reverse, we'll come back, and then we'll do the other side. Right leg back, tuck those hips under, and just slightly lean into it. Here, guys, this should not be painful, and we don't need to hold it forever. Once you find that stretch, we hold for about 30 seconds to 1 minute. Some people might be able to do 20 seconds at a time. That's completely okay. But slowly over time, it gets easier. We can build up that time and really open up those hips and glutes. A lot of times, guys, again, that low back pain can be just tight hip flexors from sitting down a lot. So this is a really good one if you have 8-hour days, you're at a desk. Highly recommend doing this one. Even for road trips, this is great to start off with. All right, solely a stretch or calf stretch. On this one, I'll walk you through again. Now, you can see here, she's using the wall, so we'll kind of use the wall here. But the goal for this one is you want to stretch this bottom piece, right? The under this big muscle right in here. So to hit that, we're going to place that foot back, just like before, but keeping that heel down flat, we're going to drop that knee, keeping those heels touching the ground, and we'll slowly come back. Right back into it, hold for 5 seconds, and right back out. And that little movement, almost every time we kind of pulse through here, we should get a little further. That heel should stay down. We should not be elevating off, right? Keep it stuck. You'll feel that tension right through here. Might even feel it all the way down to that heel down low. Hold that for a few seconds. Couple times, I have to go about 8 to 12 times. Opening it up, stretching out. If you're a runner, this is really good. Running will get that real tight. Do both sides, couple seconds each. And that's for the dynamic version. The static version is you just find that stretch and we hold. And we can hold that up to 1 minute. Slowly release. Now here, guys, we never want to hold or push past pain. We don't want to feel any tearing, any ripping, nothing like that. Just a good solid stretch. You pause, and over time, that stretch will get deeper and deeper. All right, next one, executive stretch. Now, this is one that everyone should be able to do here with me. So what we're going to do is we're going to get a chair, preferably one without some sides and shoulders here. And all we're going to do, we're going to sit down, body upright. It's a big thing, right? We don't want to hunch over. Keep that chest high. If I want to do my right hip, so we're going to get that right leg, cross it over. Now, the goal here, guys, is we want to feel that stretch in this back right hip. Now, again, we don't want to hunch our back. Keep that chest high and slowly just hinge into it. Once we find that stretch and that tension in that outer hip, We're gonna hold that 30 seconds to 1 minute, slowly release down, and then we'll switch, hit the other side. If you guys are tight in that hip, this knee might stay real high, right? It's not gonna wanna go down, but over time, we should be able to make that nice and flat, get a good stretch, and just hold, again, 30 seconds to 1 minute, and then release. Again, guys, if you have a job where you sit down 8 hours a day, doing this a couple times every hour, really work those hips, open them up for you. And again, prevent a lot of back pain that we might be experiencing. Glute activation, this is a fun one, very easy to do. Now, again, we can use the wall here, simple, right? So hips, the goal is to get this outer hip nice and strong. So up against the wall, using your leg here, we're just gonna kick back. You can put your hand right here on your hip until you feel that squeeze, slowly relax. Engage, slowly relax. What we don't want to do here, and the big mistake a lot of people start to make, is they start turning the whole body, right? Just kind of like a flamingo, they just go up and down versus just engaging and holding that squeeze. I like to hold that contraction for about 2 to 3 seconds, not very long, but we want to make sure that muscle is firing. They get nice and tight. And just, again, the stronger that is, it's going to help with hip pain, low back pain, and just overall a healthier body. All right, fun one, single leg balance. This can turn into a game if you guys have family. But main goal here, just like it sounds, balance, right? One leg, lift, and it's it. Simple, balance. Now, to make this a little challenging, we can add a little mobility here, right? So we can be here and change the weight. And slowly come back, slowly move up, change the way that gravity works with the body to keep that balance. You can also move your hands. You can come out, forward, out. Now, if you find this hard, you can't keep that balance, just right here, focus on, you can start with 10-second balance holds. You can move to 15, 20. Now, important here, guys, the feet, right? You want that weight to be even on the front and the back of the foot. We shouldn't be leaning always on the heel, and we shouldn't be always falling forward. Everything should be nice and balanced. And again, switch, make sure you do this on both sides. And you can make this a game with the family, challenge yourselves and have a little competition. It's fun to do. All right, sit to stand. So many of you don't know, but we squat every day, right? Pretty easy. Now, we can do this completely perfect. We can also do it very wrong, right? So the one mistake a lot of people do at your desk, they end up just kind of rolling and pushing up, or just falling down. What we want to start doing, and even at work, maybe it's part of the day, sit on the edge, keep that chest high, and here, using those heels, we're driving straight up, slowly coming right back down. And we could do 8 to 10 of these every hour, right? We just don't want to turn it into a rocky motion. We don't want to squeeze up. Control down, control up. Do this a couple times a day at your desk. I would say a couple every hour, just to get out of that same position, that tight hip, weak glutes. You want to get those muscles up and firing. All right, toe yoga. This is one everyone hates because it's pretty hard to do. So I'm not going to show you with my feet, but I will show you with my hands. So if you can see here, guys, we pretend that this is the big toe, and these are the 4 little toes. All we want to do, as in the photo, is elevate the big toe first by itself while keeping these down, placing the toe back down, then elevating the 4 little toes while keeping the big toe down. And hold that for a second or two. We're going to alternate back and forth, back and forth. It's going to strengthen up that foot, increase that strong arch in there. It's also going to kind of teach your brain that your foot moves independent, right? It doesn't always have to just move all together. Now, men, this is usually harder for you guys. For whatever reason, guys have a hard time with this. Girls find it a little easier, but take your time, practice. This does not have to be done barefoot. You can do it in your shoes, in your sandals. We can do it while you're at the cash register. That's when I do it. When I'm at the store, just standing, waiting in line, practice that toe yoga. You can do it seated or standing, and you can do this while you work as well. Easy to do, prevents plantar fasciitis, creates strong ankles for those ankle sprains that we get a lot too.
Great, Rick. Thank you for all that great information, great exercises, everyone. So there's different ways on how we can get this information to you, but one of the quickest ways is I'm about to put a link into the chat. We have a YouTube channel where we cover a lot of things for runners and for different kind of symptoms. We also have different exercises on form holding, like Rick was talking about at the beginning. You can go ahead and use this link and kind of go through whatever you need, kind of keep it as a reference whenever you have something going on, especially if you want to come and see us. This is a good way to have the information on how to schedule and things like that. So a couple of additional tips and tricks that we want to talk about before we talk a little bit more about Airrosti. Pay attention to your posture when standing. One of the questions that we got a little while ago was, how do the floor mats work better? How do we do when we're standing? One thing that you always want to make sure is that as long as you are in a standing up position and everything is, not shifting over to the sides, then that's going to be a good way to stand. You always want to have a combination of standing and sitting. So not sitting all the time or not standing all the time. You want to be kind of in between. So one thing that we've always said is put a book, a little stool, something underneath your desk to where if you put your leg on there, it kind of helps support some of that weight. Sometimes when we're standing for too long, I'm guilty of this all the time, is I'll shift my weight over to one side and then shift my weight over to the other side, causing a lot of imbalancement and causing a lot of tightness. So one of the tips and one of the tricks that we can give you is by just elevating that leg or elevating that foot, it kind of causes you not to shift over to the sides. So this is for our guys out there. Do not sit on your wallet. Keep it in your front pocket. Our wallet is kind of like our purse, right? We put everything in there, business cards, receipts, money, everything. So the wallet can get as thick, pretty thick. If we sit on it for too long, it causes the hip to imbalance, and that's also going to cause a lot of hip pain, back pain, even, can shoot down to the knees or to the ankles. So one of the suggestions that we have, if you're going to be sitting on it at work, maybe put it in your drawer. If you're going to be driving for more than 2-3 hours, definitely take that off, put it somewhere where you know where you left it so you won't lose it. But just want to make sure that you don't cause too much friction between the hips. So when something hurts, do I use ice to decrease the pain and inflammation? So we got this question a little while ago too, heat versus cold. So we definitely recommend ice or an ice pack kind of to help lower down that inflammation. 20 minutes on, 20 minutes off, and then 20 minutes back on if we can. It's really going to help decrease inflammation really quickly. So definitely try to use ice whenever dealing with any aches or pains. And then stay hydrated. So what I mean by that, it doesn't mean if you're feeling a little bit parched because it's hot outside. 8 glasses of 8 ounces of water a day is going to help keep our muscles and our tissues lubricated. So what that means is, as Dr. Ramon takes a sip, you see that? What we mean by is that our muscles, if they get really stuck together, we lose that range of motion. So we're obviously overcompensating, doing things that we're not supposed to be doing with our body, right? So we want to make sure that our muscles and tissues stay nice and lubricated, and we can go ahead and just lift things properly, kind of, sit down properly, things like that. So 8 glasses of 8 ounces of water a day. There's some more information about Airrosti. So as of right now, we've treated over 1 million patient cases. And with the 1 million patient cases, we are at a 3.2 average number of visits. So that's 3 to 4 visits to injury resolution. One of the big numbers that we're proud to share on here is that we've been able to prevent over 16,000 surgeries. So these are all patients that were told that they needed some type of surgical intervention to get rid of the ache, the pain, the condition that they were dealing with, came to Airrosti, went through our 3 to 4 visits, and felt like they no longer had to go for that surgery. So that's not only huge in time savings, but that's also big on cost savings, right? We know how expensive all of that stuff can be. So we always recommend coming to us first with any aches or pains to see if we need to go down that route. You're not a candidate for Airrosti if you have something broken, fractured, or torn. So we're not going to treat you. We're not going to charge you for our assessment, but we're not going to charge you for our visit either because we didn't do any treatment. But then talking to Dr. Ramon, we can go ahead and find the next best option for you. Next thing we have on here is 88.3% of report full recovery. And we compare that to 99.5% of patients that would recommend Airrosti to friends and family. Now there's about an 11% difference between those that we actually fix versus those that would recommend this to friends and family. And the reason for that difference is because we did right by those 11%. Those patients came into the office. We knew we're not going to be, helpful for them. We're not the best choice for them. We didn't charge them for the visit, and then we got them to where we needed to. So it's always a good starting off point if you have any aches or pains to come in for. Again, this is just a reminder of all the different things that we treat in the office. So anything from headaches and migraines all the way down to bottom of the foot pain. Like I said, you don't have to have a diagnosis already. You don't have to come in and say, I have bicep tendonitis, plantar tendonitis, plantar fasciitis. It is our job to diagnose you. You just have to come in and let us know exactly where it hurts. So don't worry about this list, you know, by like that. This is all that we treat. Pretty much we treat anything that's dealing with the muscle system. So don't worry about that. One thing to worry about is the benefit, right? Is it covered? Well, we are an in-network benefit for all employees and dependents on the Aetna health plan. There is no referral required, so we are direct access. You don't have to go see your primary doctor to get a referral to come and see us. You can come straight to us. These are all our locations, all our docs here in the Valley. So obviously we have Dr. Ramon right here in the Austin, Edinburgh area. Airrosti, Edinburgh, not Austin. Airrosti, Edinburgh area. We also have Dr. Cantu, so we have 2 doctors there. We have a clinic in Harlingen, and we also have a clinic in Brownsville. Question about hours earlier. So we do have early morning appointments available, late afternoons on Tuesdays through Friday. And then we're also open on Saturdays from 8 to 12. So we make it very convenient for you guys to get on the schedule, you know, to get seen. All of our appointments are an hour long. So if you're scheduled at 9 in the morning, you're in at 9 and you're out by 10, you don't have to take the whole day off. You just have to worry about that 1 hour visit with us. Within that 1 hour, you get 30 minutes of manual therapy, 30 minutes of the active rehab. And this is all one-on-one care. So there's not a whole bunch of people in the room when we're doing this. It's just you and the provider one-on-one. So it's very convenient and very easy for you guys to, you know, come in and get treated and get all your MSK issues resolved. One great thing that has come from the pandemic for us is that we introduced a new program that's called VIP Chat. This is an opportunity for you to jump on with one of our providers. So we're not outsourcing this to any company. The Airrosti providers that you'll be talking to are the Airrosti providers that have trained and everything through Airrosti. So they're the actual Airrosti providers that you'll be talking to. It's a free 15, 20-minute conversation with them. You can go over any questions that you may have. You can talk to them about this particular injury, and then we'll be able to determine if you're a candidate for Airrosti or if you need to get you down, you know, off to a referral for an X-ray or for an MRI. This is an absolutely free service. There's no charge for this. This obviously we're doing the presentation right now for Hidalgo County employees, but this is not only specific to you all. If you have family members that are not on the insurance, they can use this service as well. So you can scan the QR code right now with your phone. That can get you the link. I'm also going to copy it and paste it in the chat right now. There we go. And you can just use that. Obviously, we know that not everybody on this call is dealing with ache or pain right now, but it's a good thing to save this information. I always like to compare it to the nurse's line that they tell you to use before going to the ER. Same thing. If you have any aches or pains, jump on this call with one of our providers, and let's see what we can do to help you at Airrosti. And that's our presentation today. I hope everybody got some good information. If you're interested in getting scheduled with Airrosti, you can always call this 1-800 number right here. It's a 1-800-404-6050, or you can always go to airrosti.com to go get more information. So I think next we're going to pass it over to Diana to kind of walk us through some of the questions and answers.
Yes, awesome. Thank you so much, gentlemen. This was a really, really great presentation full of wonderful information. I know our employees always enjoy y'all's presentations because they are so beneficial to all of us, especially sitting down. A lot of us are in the office sitting down for long periods of time. And then, of course, some of us are up and outside all day. So, of course, that also contributes to other types of pain and injuries or things like that. So one of the questions that we do have is, do the shoes you wear have an effect on posture? And I'm assuming also on kind of any attributed pain that could have an effect on that.
I think so. We see it with our patients. You get patients that come in that say, hey, I've not been able to wear my high heels in a long time, you know, because of my foot pain, because of my Achilles pain, right? I mean, you have the extreme of a high heel all the way to flats. And of course, you know, we always recommend the flatter, the better, I think, for our patients, you know, especially when we're treating them for Achilles tendonitis or some foot pain, you know, those kinds of things. So it certainly can contribute to your pain right over there. Once we get a little bit better as far as mobility is concerned with the areas that we're treating for them, we try to get them back into something a little bit flatter as far as shoe is concerned. Same thing with running shoes. I mean, there's different running shoes for everybody. There's a running shoe out there for everybody to use. Some have a bigger heel drop than others. Some are more flat, you know, so it's just about finding the right shoe that works for you. Your body will tell you which ones are good for you and which ones are not, you know.
Okay, awesome. Somebody asked if y'all treat TMJ.
Yes, we do. Yes.
Okay, awesome. Okay, and then I think we'll just do one more question. Somebody asked about floor mats and in the office making a big difference for lower back pain. I know that sometimes we can get those like padded floor mats, I guess, for our chairs or just to stand on. Would you say that those make somewhat of a difference?
I've never recommended that for a patient before. I don't know, I guess it depends on that individual, right? If they were to maybe to try something like that at home, it's a little bit softer, a little bit more cushion. I tend to lean like away from extra cushion and extra padding,
Okay.
I think if you're having a little bit of lower back issues, maybe pain at the bottom of the foot, I don't necessarily think softer is better for you. I think that just tends to weaken some of the muscles that are supposed to be stronger. That person is probably lacking a little bit of strength in certain areas. Some of the muscles are supposed to be doing their job. They're a little bit too weak and tend to fall. So I would say just try it, see what happens, see how they like it first before they commit to really doing it full time, 8 hours a day at work.
Right, definitely. Great. Well, awesome. Thank you guys so much. This was a really great presentation, and I know our employees really enjoy having y'all here with us. Thank you, everyone, for your participation and all the great questions. This does conclude our 8th and final webinar of the 2022 Hidalgo County Employee Wellness Fair. Thank you so much to everyone who attended for making and thank you to everyone who attended our in-person event and our virtual events. Y'all really helped make this event a success. If anyone does ever have any questions, you can reach the wellness program at hidalgocounty.wellness@co.hidalgo.tx.us or reach out to us via our website or anything like that. We again are very happy that we could have so many great attendees on here today, and thank you again, guys, for your great expertise.
Thank you for having us. We had fun.
Thanks. Y'all have a good day. Bye bye.
Bye-bye. Thank you.